Hi, I'm Dr. Dubey here at Capital Dentists in Washington, D.C. We get a lot of questions about Invisalign, so I'm going to answer some of the most commonly asked questions about Invisalign and get you a better understanding of the subject.
Dr. Dubey, what is Invisalign?
Invisalign is basically a patient wearing clear trays or clear aligners, that's what it's commonly called, and get orthodontic treatment out of it. Now, when patients wear those, the trays along with the attachments on the teeth move your teeth in a certain manner, but nobody knows about it. So that's what Invisalign means. It's invisible and you're getting your orthodontic treatment done.
How does Invisalign compare to traditional braces?
The basic difference is aesthetics. That's number one. Invisalign is much faster. Now, in terms of aesthetics, when we are doing Invisalign, we put attachments on your teeth which are to the color of your teeth. And those trays go on, which are clear trays. So you wear your trays basically, and those are moving your teeth. Now with traditional braces, you have wires, you have brackets which are of metal so everybody can see. With Invisalign, nobody knows and you're going through an orthodontic treatment.
Is Invisalign really faster than braces?
Yes, absolutely. Invisalign is way faster than braces. It's very efficient. And best part is nobody knows about it.
Why is Invisalign often considered more comfortable than braces?
Simply because of two reasons. Number one, you can take out your trays and you can brush and floss normally. Number two is when you're eating, you can take out your trays and you can eat normally and then brush and floss after and put your trays back on. That's the main, most important part. With traditional braces, you have brackets, you have wires, and everything gets stuck in between, and then you are, striving hard to get everything out of your mouth. But with Invisalign, because there are no wires, there is no sticking of food around, and you can just eat and be normal.
How long does it take to straighten teeth with Invisalign?
It depends from case to case and how complicated or not complicated your case is. So anywhere between 4 months to about a year that's the typical timeline.
What is the process involved?
The process is very simple. What we do is we take records, and what that entails is we will take pictures of your mouth, we do scans of your inside of your teeth, and then we send all of that to Invisalign with what we want and how we want your teeth to shift or move. Invisalign comes back and tells us, hey, for this much, these many steps, we need these many trays. We bring you back in, we deliver the trays to you, we put attachments on your teeth, and off you go with a certain amount of trays in your hand. We ask you to change your trays every week, depending on, or maybe every 2 weeks, depending on. Once you're done with the tray, you regularly come back and see us, just so that we are tracking your teeth and seeing how you're progressing with your treatment. And we give you next batch of trays. And if you're traveling, we give you all your trays, and you send us pictures back of your mouth and tell us how you're tracking. And if we see something, we bring you back in. So it's very, very simple. It's not complicated. It's hassle-free.
What are Invisalign trays and how many will I need?
What are Invisalign trays? So trays are clear trays that cover all surfaces of your teeth on the top arch and on the bottom. And how many trays depends on what are we trying to achieve. So it depends on how many months your treatment is going and what kind of teeth shift are we trying to do.
Do I sleep with Invisalign?
Yes, absolutely. So you're basically wearing your Invisalign about 22 hours of the day. Same thing as traditional braces that you're wearing 24 hours. The only time you're taking your trays out is when you're brushing and flossing your teeth and when you are drinking something super hot or eating. That's the only time we ask you to take off your trays, feel free, enjoy your food, your meal or your snack, and then put the trays right back on.
Is there anything that could disqualify me from using Invisalign?
Not unless and until there is some kind of a jaw surgery that you require. That is the only time we tell patients to not get Invisalign, go towards a traditional route. But in today's time and age, everything can be achieved by Invisalign.
Can Invisalign fix crossbite?
It can fix crossbites if it's bilateral, yes, absolutely. And even unilateral, so yeah, these days Invisalign is going above and beyond to taking care of all sorts of patients. Yeah.
Is Invisalign painful?
Not at all. There may be a certain amount of soreness here or there, but none of our patients have ever said that Invisalign has been painful, and nothing that cannot be taken care of by Tylenol and ibuprofen, whatever you take for headaches. So not at all. It's a very, very pleasant process to go through.
Does most dental insurance cover the cost of Invisalign?
Invisalign is orthodontic treatment, so if depending on your plan, your insurance should cover some part of it. Yes, absolutely.
Does Medicaid cover Invisalign?
Medicaid coverage of Invisalign may be true, but we would have to talk to your plan on your insurance.
How much does Invisalign cost without dental insurance?
The typical cost of Invisalign is anywhere between 5,500 to 7,000, depending on the complexity of your case. So I would say that's the median. So I would say that is there may be a median on that.
How can I schedule an appointment to talk with a dentist about Invisalign?
That is very simple. I'm Dr. Dubey here at Capital Dentist. Give us a call at 202-223-2070 and make your appointment. Come in for a free consult. We are happy to take a look, see. We are happy to do your scans and see how we can help you to get onto the journey of your Invisalign. I hope I answered some of your questions. If you have more questions, please feel free to give us a call or come right in. Capital Dentist, 202-223-2070. I'm Dr. Dubey signing out. Bye-bye.